Hello, everyone, and thank you very much for joining us today. Today, the topic is Tobacco 101, Tools and Methods Needed to Achieve Tobacco Cessation. So we hope that the information we provide you with today will help you better engage with Asian American, Native Hawaiian, and Pacific Islander communities. So today's presentation is hosted by APPEAL, the Asian Pacific Partners for Empowerment, Advocacy, and Leadership. The presentation is brought to you by APPEAL's National Network Initiative, RAISE. So today's agenda, we'll be hearing from the Asian Smokers Quitline and also from the Center for Pan-Asian Community Service, followed by a brief Q&A session with our expert panelists. My name is Farah Rafai, and I'm the Program Manager of the RAISE Network at APPEAL. I will be presenting and facilitating the presentation today. Today, we'll be hearing presentations from our RAISE partner, the Center for Pan-Asian Community Services, and also a frequent collaborator of ours, the Asian Smokers Quitline. Both organizations will present on tools and methods that they have used successfully to engage with Asian American communities. Today, we hope to increase your understanding of effective tobacco cessation methods that impact the Asian American, Native Hawaiian, and Pacific Islander communities by discussing the importance and impact of smoking quitlines, smoke-free ordinances, and community partnerships. To start us off with discussing a very important tool in tobacco cessation, the smoking quitline, we have Cherry Ng from the Asian Smokers Quitline. Cherry is a project manager of the CDC-funded National Asian Smokers Quitline. She has over 10 years of experience in managing public relations with nonprofit organizations, healthcare professional groups, and community-based organizations and corporations. In her current role, Cherry is responsible for publicizing information on and increasing awareness about the value of the Asian Smokers Quitline and its services. Cherry, thank you for being with us today, and you have the floor.
Thank you, Farah, and thank you, everyone. And it's really my pleasure to be here to share our services with all of you today. And I just want to give a quick introduction about our program. And for what we are trying to cover today, it's some of the topics that we'll take a closer look of the ASQ services and the advocacy of the and also the advocacies of our programs and the resources for the ASQ partners. And we will also talk about what kind of resources that you can use and you can provide it to your smokers and also to assist other smokers to quit smoking. And also some of the partnership activities and ideas that we have in the past. Okay, so these are the topics that we are going to talk about, and then also I just want to start with the brief introductions of ASQ services. ASQ is an evidence-based interventions protocol, and we are not only providing the service in one state, but our service is a nationwide program. So all of the smokers, if they speak Chinese in Mandarin or Cantonese, Korean or Vietnamese, they can call the ASQ Quitline. It's a free service, and they can use the telephone to call us, and also we have the online resources, and we send them materials. And our service is funded by CDC, and it is operated by the University of California, San Diego in 1993, and in 2012, we become nationwide. So as of today, we have served over 13,000 Asian language speakers from all 50 states. And our operations hours are Monday through Friday, 7 a.m. to 9 p.m. Pacific Standard Time, which is 10 a.m. to midnight Eastern Standard Time. So for our ASQ service, the primary service that we provide to the smokers who speak the Asian languages are telephone counseling. And so for our telephone counselings, when the caller first called us, it takes about 7 to 10 minutes for the intake calls. And then after that intake calls, we will have a counseling call that is a pre-quit call, which is we help the clients to think about what they need to prepare themselves in order to quit smoking and also to have some planning. So for the pre-quit call, which is the very first counseling call, it takes about 20 minutes to 30 minutes, and we can also break it up to different sections according to different clients' needs. And for each of these calls, all of these calls are one-on-one call, and all these services are delivered by our trained counselors. And all of our counselors, they speak that language. So, for example, if a counselor get a call from the Chinese Quitline, so it's only the counselors who can speak that language pick up the phones. So the language that first the callers will be heard is it's the language that they called in. So Mandarin or Cantonese or Korean or Vietnamese. So that way it makes them feel that they don't have to jump through so many hoops in order to get the persons who can speak that language. So all of the calls will be confidential, and it's a proactive follow phone calls as well. And so for each initial sections, which is the very first counseling call, what we are focusing a lot is to help the clients to think about what are their motivations of quitting smoking in order to help them to build their self-confidence. And we also want to help them to think about what are the alternative strategies that they can do if they have the movement that they really want to have that cigarette. What are the things that they can do instead of just go to smoking. And then at the end of the very first call, we always encourage them to make quit attempts, because for so many plannings that they have talked about or they have discussed, if they do not put words into actions, everything is just theory. So that's why we always encourage the clients to think about to make a quit attempt. So after that first counseling call, we also provide up to 4 follow-up sections, and it's about 5 minutes to 10 minutes each. And the ideas of having these follow-up sections is because we want to give them the support and also want to check on with them and see if they have any questions when they're using their quitting aid or during their quitting smoking days. What are the challenges or things that they would like to discuss with our counselors? Because of that, we have our follow-up sections scheduled in these graphs, what is we call relapse-sensitive scheduling, because we all know that smoking is a habit that smokers have been developed for so long. So usually it's very hard for them to just quit one day and then they don't smoke. And especially during the first week, that is the time that the smokers usually will go back to smoke due to various reasons. And we know that the first 7 days is a very critical moment, so we want to schedule more calls during the first 7 days, and we want to let them know that we are here, we give them the support that they need, and we also answer the questions that they may have or the withdrawal symptoms that they are going through. We want to let them know that for some of the things that they are going through right now, there are some other things that they can also help themselves to deal with it. So that's why our follow-up sections are not scheduling based on time. We schedule that based on what we call relapse-sensitive scheduling. As you can see that we will give them a call on a quick day, and then 2 days after the call, and then 1 week call, 2 week call, and then 1 month call. As we believe that after, and a study shows us that after the first week, if they stay quit, the chances that they can stay quit longer will about the same. So after first week, they're usually pretty okay with it. And then, so we have been doing all of these scheduling, follow-ups, providing the phone counselings. And people may have a question, does it really work? Does Asian callers will call the Quitline and then to quit smoking? And we have done a studies, and this is a randomized trial that we have recruited the smokers in different languages, Chinese, Vietnamese, and Korean. So basically, we randomized them to 2 different groups. One group is the self-help materials. They will only receive the self-help materials. And then the other group, it's not only the self-help materials, but they receive the counseling. And then these studies, randomized trials embedded in California Quitline service during 2004 to 2008. During that time, the Asian language services are only available in California state. So we did a randomized trial. We want to see if the same effectiveness will also apply to our Asian-speaking clients. So smokers who called the Quitlines, Chinese, Korean, and Vietnamese phone lines between 2004 and 2008, they were recruited to these trials. In this study, a culturally tailored counseling protocol was developed in English, and then we translated into Chinese, Korean, and Vietnamese. And we tested the effects of telephone counseling for smoking cessations in Chinese, Korean, and Vietnamese-speaking smokers. And we found that it's actually effective to our groups. First of all, this is one of the foundings that we have found. It's a quit attempts. And for the groups that they only receive the self-help materials, it's about 47% of them, they made a serious quit attempts. Serious quit attempts means that at least they have quit 24 hours or more. And then for the clients that they are not only getting the self-help materials, but they are also getting multiple counseling sections, there are about 60% of these groups, they are making serious quit attempts. So we can see that counseling does also encourage people to make the quit attempts. Quit attempts are vitally important in population-based cessations because most tobacco users must try repeatedly to quit before they succeed. So we always encourage our clients to make quit attempts, even though there are moments that they think that, oh, they want to wait, but we don't want them to wait too long after the first counseling call because we want them to capture the moment that they're very motivated and they are all really having that ideas that they want to deal with. So we want to capture that golden moment. Quit attempts, it's something that we always encourage our clients to give a try. And then on these graphs here, it's called relapse curve. This is actually the results show that telephone counseling approximately doubles the quit rate compared with self-help materials. Moreover, the same counseling protocol can be effectively applied to multiple Asian language groups. So as we can see here, the dotted line represents the self-help materials group. People that they stay quit after about 6 months. We did a 7-month evaluation, and we found that there are still about like close to 20% of them, they are staying quit at 6 months. And then for the groups that if they also get counseling, it's almost doubles the stay quit rate. So we can see that it's effective. And the telephone counseling, it also applies for people that they're not only for the English speakers, but also it applies for people that they speak Chinese, Korean, and Vietnamese speaking smokers. So that's why we know that the telephone counseling that we are providing to our clients, it's helpful to them. And besides the telephone counseling, ASQ does have other services. One of the booklets that we send out to our clients is the in-language self-help booklets for the smokers. So we have it translated it into different languages, and for all the clients that they called us, we will send these booklets to them for the language that they choose. And we also provide quitting aid. So for clients that they are eligible to receive the nicotine patches, then we will send them the 2-week supply of the nicotine patches. And for some of the clients, if they do have contraindications, it doesn't mean that they will immediately become ineligible. They will not. We won't deny. Okay, let me rephrase it. So for clients that if they have contraindications, they may still qualify to get the free patches. It just we would need their doctor's approval for that one. So we always encourage the smokers, if they wanted to know if they're eligible to get the free patches, please call ASQ to find out more, and our counselors will provide information to them. And besides providing the telephone counseling and the booklets to the smokers, we also encourage the proxy to call the ASQ line. So for proxy, they are not smokers, but they are the friends or family members of a smokers. They care about their beloved one being a smoker, and they want to help them to quit smoking. So they can call ASQ line, and we do have a specific materials for these people, and these are the materials that they can talk about, and they can take some of the tips or advice and then apply those tips and advice to the smokers, and also encourage them to make quit attempts. Or if there are other things that they think they could help the smokers, they can also, use some of the strategies that we suggest in the booklet to help them to quit. And besides the telephone counseling, offer the services through sending them the free patches and send them the free booklets. ASQ website had just got revamped, and there are informations that we have, redesigned, and we want to make it more user-friendly and targeted to the specific audience. Now we have the information for smokers, friend and family, healthcare providers, and also for our community partners. So if you are interested interested in getting some of the information immediately, you can always visit our website, and that is asiansmokersquitline.org. And some of the service that we offer online, we offer that is the things called online enrollment. So basically, for some of our clients, we know that it may be really hard for them to make a phone call during their work hours or during our operations hours. What we want to help them is we create an online form so they can sign up for the telephone counseling by going to our website, and then just to put down some of their basic information and share about their smoking situations and submit it online. Once we received it, our ASQ counselors will contact them within 2 business days. And the reasons that we will call them back is because if they have said that they are the smokers, and we want to ask for their health conditions to make sure that they are eligible to get the free patches. So for these follow-up calls from our counselors, it takes about less than 3 minutes or 5 minutes. There are just a few questions that we need to go over with people who register online. And then once we got those answered, questions being answered, then we can send the patches to the eligible smokers. So that way, it gives them another options, not just calling us, but they can first, fill out the intake form, and then that way, that makes them feel that they spend less time on the phone. They can use their own time and place, and then to fill out the form. And all of these forms have been translated into Chinese, Korean, and Vietnamese. So if you are out there to help the smokers, this is one of the way that you can refer them to us and encourage them to sign up online. And besides the online form, we also have free ASQ materials like the fact sheets in several different topics. So far, we have some of the topics has been translated to all 3 languages, and there are more fact sheets coming up to be available in different languages. But for the patches and for some of the quitting tools information sheets, we have already translated, and we also have fact sheets that talks about the top 10 quit tips, and the fact sheets that we make it available for our community partners to use. For example, how to refer smokers to ASQ. And besides talking about our services, I would also like to let all of you know that ASQ cannot do all these work without partners with our community partners, healthcare providers, and many other organizations. So I want to highlight some of the partnerships activities that we have done in the past, and also want to encourage, all of you to share your ideas or things that you think we can team up together and to work together. And then because reaching out to the limited English proficiency group, it's very hard, and it cannot be done without all of your partnerships and your support. So by speaking of that, I just want to start with the CDC National Network Partner. So in the past, Self-Made Health Network Appeal, we have previous partnership activities. For example, like the webinars that we are having today, Appeal hosted for us, and also Self-Made has also invited our previous, project managers to share about the ASQ services and other useful information. And you can also, share the blog posts or some of the articles that ASQ has come up with on your website. And these are some of the ways that we can promote the smoking cessation message to the community. And then in a state level, we also partner with Alaska Tobacco Quitline, California Smokers Helpline, Hawaiian Quitline, and they have shared our information or in-language numbers and some of the materials on the website. And California Smokers Helpline, ASQ have a long relationship with California Smokers Helpline. So I just want to use it as an example to let you know what are specific things that you can help to promote the smoking cessations to your group that are speaking in Chinese, Korean, or Vietnamese. So on the California Smokers Helpline website, they have a page that's encouraged their callers to sign up online as well. So basically what they do, they have the different language options on top of their screen, on their website. So for people that they speak Chinese, Korean, or Vietnamese, they can just click on that language options, and then it takes it directly to the ASQ homepage in that language. So it makes it easier for the smokers. They may not know that there will be in-language service to help them to quit smoking, but there are some state Quitline maybe it's really well known in that particular state. So this is one of the way that you can promote the service to the Asian language speaking group. So that way it helps them to connect with the smoking cessation service faster. So besides partnering with the state Quitline, we have also have different kind of partnerships. Again, this is just one of the examples that we want to share with all of you. So one of the partnership activities that we have been doing is co-branding. Co-branding is one of the partnership activities that we think is very helpful because it helps the partners to expand the service they provide to their community members. And it also allows our partners an opportunity to promote their relationship with ASQ to the community, and it also helps both of us to co-promote each other's service. And again, like in that particular community, they may know a local service and they may not know who is ASQ, what ASQ does, but they will go to the community health centers to get their health services, and then their doctors, if they know they're the smokers or the physicians or the nurse or social workers, they know that this is a person that they may need some help to help them to quit smoking. Then you can refer them to ASQ line, and we have it in different languages. So that way that make them feel it's more comfortable because they are being referred by somebody that they actually know. And also, we do media campaigns with different groups, and this is one of the examples that I'm using here. It's from the Asian Pacific Islander Coalition Against Tobacco, APICAT, in Seattle. And so during the Lunar New Year in 2016, they have a message to encourage the community members to quit smoking now, and they have the different language line numbers that are posted there. And then for these free ASQ ads creatives, you can also go to the CDC website that is called Media Campaign Resource Center. I have the link here. And so they have some of the ad creatives that is in language, not just in Asia, not just in Chinese, Korean, or Vietnamese. They also have different kinds of ad creatives. And I really encourage all of you to visit this website and to explore it. And they have different filters you can use. You can filter the ads by languages or the audience or videos or print. So it's a really great resources. And all of these ads are ready for made. And then some of them, they are video ads. And you can go through, the different steps and to sign up the service and then get the ready-made ads for your use. And here are some of the ASQ sample ad creatives that are already in the MCRC website. And if you're interested in, accessing one of these ads, you can always go to the MCRC or you can contact me. And I also want to let you know that our community partners, they would go to community events. Since ASQ is just one of us here, we cannot go to all the different community events. We do have an option for the community partners to contact us, and we will land the display, which you see that is on the floor, and also the table runner that has our numbers on it. You can, contact me, and we can coordinate it and see how we can ship it to you, and you can bring these, not just our print materials, but also our displays to your community events. And the assistance that we provide to our partners, besides providing the telephone counseling, is always our primary service that we provide to our clients. And we also receive some requests to review some of the translated materials, and such as print ad, press release, fact sheets, postcards. If our time schedules and capacity allowed, we are more than happy to do it, and we will provide a culturally appropriate translation feedback. And sometimes if our time is allowed, we may be able to help you to translate some of your materials. If we cannot do it, we will try to connect you with other partners that we know that may be able to do it, or try to find the translation service that we know for you. And then there is another national network that national partners that I want to mention here is called National Council of Asian Pacific Islander Physicians, NCAPIP. Early this year, we talked about how we can collaborate or work together. So basically, NCAPIP is a group that they want to promote the health to Asian American. And then this year, they want to talk more about how to increase the awareness of the Asian Americans about treating their diabetes situations. So we co-wrote a press release, and then we promote the importance of screening and body mass index at 23, and also promoted that ASQ has the different language options that we can help the people who have the diabetes situations, but they are also the smokers. So ASQ can help you to quit smoking, and hopefully by quitting smoking, you can take control of your diabetes situations. So this is one of the collaborations that we have done together, and here are the samples of the press release that we translated it into different languages, and we release it to our media outlets. And then proactive referral, it's another way that you can do. So here are two long-term partnerships that we have been partnering together. So Asian Health Services, Asian Americans for Equality, I just want to highlight that these are the groups that they meet their community partners, community members every day, or they have a regular meetings with them, so they know their community members well. So one of the things that to help these people to quit smoking, not just giving them the numbers, because a lot of times the members may just feel that, okay, I want to quit, but then they may forget it or they may lose the number. There could be a lot of different things. And again, capture that golden moment when you talk to your community partners or patients when they are when they are motivated to quit smoking. So proactive referral options, we do have e-referral options that you can refer patients to us through electronic health record. That one we need some technical setup. So if you're interested in using that option, feel free to contact me. And then there is another option. It's easy to use and it's almost immediately you can use it. It's called web-based referral. We have also revamped it and also make it more easier for the partners to use. And you can go to our AsianSmokersQuitline.org website and then just click on web-based referral, and it will take you to the page. If you haven't registered yet, there is a link for you to submit your registration, or if you have already registered, you just need to find your organizations and then type in your patient's information and send it to us. And our counsels will also contact the clients within the next week and make 5 outbound calls to see if we can reach the clients to provide a service to them. So there are just some ideas about partnerships, and I'm sure there are more other creative ideas that you may have, and there are no partnerships that is too small, so I welcome all the ideas. And so if you have any ideas, do feel free to contact me, and this is my phone number, my email address, and the picture next to my contact information, that is me. So thank you again, and we will just wait until the end of the presentations and answer the questions.
Thank you very much, Terry. That was a wonderful and very informative presentation. So I know many of you have questions for Terry in the chat box, and we will do our best to direct them to her during our Q&A session. So now we will hear from our RACE partner, the Center for Pan-Asian Community Services. We will be joined by Liz Doe from the she is the Drug-Free Communities Program Coordinator at CPACS, and she also oversees the Georgia Team Empowerment Coalition, also known as GATE. Joining her, we have Caitlin Kavan, who is a health program coordinator at CPACS and who works directly with Appeal in our national network initiative, RAISE. They will both be discussing the city of Clarkston and successfully passing the smoke-free ordinance over there. Liz and Caitlin, please take it away whenever you're ready.
Okay. Thank you so much, Sherry, for that presentation. So yes, speaking right now, my name is Caitlin. I'm just going to go and give a little intro of, Georgia and our organization as a whole. So this is just an overview of the AAPI population in Georgia. Right now we have the 5th fastest growing population of Asian American and Pacific Islanders in the nation. And the top 10 counties with the most AAPI populations are bolded on the screen. And currently CPACS is located in DeKalb County, so we have the privilege of serving a very diverse and large group of Asian American and Pacific Islanders. And so CPACS, it's easier to call it CPACS the longer name of it. So we're a private nonprofit located in Atlanta, and our mission is to promote self-sufficiency and equity for immigrants, refugees, and the underprivileged through comprehensive health and social services, capacity building, and advocacy. And so the graph here shows just the plethora of services that we provide here. And we're founded on the belief that people need people, and CPACS is the first, the largest, and the oldest organization in the Southeast to focus on issues and concerns of Asian Americans, especially women, children, and families with low income.
All right, so this is Liz. I want to introduce the GATE Coalition, which is a substance abuse prevention coalition under CPACS. Our vision is for healthy API and Latino communities of Georgia to live without tobacco, alcohol, drug, and other substance abuse. And then our mission is to engage and empower API and Latino communities of Georgia to prevent underage alcohol, tobacco, drug, and other substances. And then, so I want to introduce our method, which is the smoke-free ordinance. It prohibits the use of smoking hookah and e-cigarettes in all public places and all public and private workplaces, 30 feet from entrances. So before I move on, I want to tell you why we chose to do a smoke-free ordinance. One of our grants is a DFC grant, Drug-Free Communities grant, and under that grant, one of our strategies is to promote smoke-free areas. And a lot of these areas are in our 3 target communities, which is Clarkston, Chamblee, and Doraville, which I will introduce later, but I do want to get into why a smoke-free ordinance is good for the community. So first, exposure to secondhand smoke causes heart disease and lung cancer in non-smoking adults and can cause various illnesses for children, such as asthma and respiratory symptoms. Also, most secondhand smoke exposure can occur in homes and workplaces. People are exposed in these public places like restaurants and bars, and a lot of these people who have lower income and lower education are less likely to be covered by smoke-free laws in work sites, restaurants, and bars. Even very small amount of exposure can be harmful to people's health, and with the smoke-free ordinance, it can eliminate these potential exposure to non-smokers, children, and the elderly. So a brief overview of Georgia's smoke-free history. You can see at the bottom of the graph the years. So in the past 12 years, we haven't had much change. It's been gradually going up about in 2016. So we had about 5 cities that have adopted a smoke-free ordinance. But our target is to have all 159 counties and 536 cities to adopt a smoke-free ordinance. And this graph was taken from our Georgia Department of Public Health. So this kind of just shows a map of Georgia and the cities that have adopted these ordinances. So you can see up in the north, Clarkston is actually one of our target cities, so they have adopted a smoke-free ordinance. So at a glance, you can see the city of Clarkston within Georgia. It's not too far from Atlanta, but it is about 1.4 square miles, I believe. But going into the demographics, there are about 7,000 people. There's a population under 18 that is 28%, and then there are about 64% minority-owned businesses, 43.9% that are below the poverty level, and about 32% that don't have any health insurance, with the median household income of $35,000. So on the right, you can see a breakdown of the race and ethnicity in Clarkston. So you can see Asian is taking up about the second most highest population in Clarkston. The number of tobacco retailers in Clarkston, so like I stated before, Clarkston is about 1.4 square miles, but I believe it increased to about 3 square miles now. It's still pretty small compared to our other target cities, which are about 5 square miles. And then the number of tobacco retailers is about 47, which is pretty high compared to our other target cities, which have about the same amount of tobacco licenses, but they just have a bigger square mile radius. So looking at our timeline from 2014, we had submitted a draft of the ordinance to the City of Clarkston, and then in 2015 we had hosted a Clarkston Youth Leadership Workshop. A lot of our youth were they played a big role in helping us pass this ordinance. And then in 2016, we had held a couple of events within Clarkston. So we did a coffee with the cops. We participated in Clarkston 2040. We did a marijuana public hearing. We also we attended a couple of public hearings. And then in September, the ordinance became effective. So moving on from when it was passed, we actually had a few hiccups here and there, but for the ordinance to become successful, we needed to require some form of educational contact from the city. There were requirements of signage, a universal smoke-free symbol, in addition to signages that were in at least 5 languages, and Clarkston would allow indoor smoking for current permitted businesses until 2018. So they were all grandfathered in until the end of this year. So what has happened since it passed? And recently in March 2018, we had held 2 public hearings that were created to revisit the ordinance. And the reason to revisit these were to address whether to remove hookah from the ordinance. The room was pretty jam-packed of business owners and their customers, and they all argued that they wanted hookah removed because it was cultural and that they didn't believe it was a harmful substance. A lot of our partners who are local and state partners who came to speak at the public hearing in support of the ordinance, we were treated as outsiders. So a lot of these businesses that stated that removing hookah would affect their businesses and their income. And then on April 3rd, a couple months ago, they had voted on the revised ordinance, and they decided to extend the grandfather clause. So the businesses that were permitted until the end of this year, they would be extended for another 2 years. And then no smoking would be permitted before 9 p.m., but hookah was allowed after 9 p.m. in establishments that had hookah licenses. And there would be an annual permit fee of $1,000, and this money would be believed to pay for the enforcement of these businesses. And then no one under 18 was allowed in the establishments at any time. Only after 9 p.m., people who were 21 and up were able to enter. So we had a lot of lessons learned. This ordinance does need constant monitoring and evaluation. Business owners, their customers, and youth need to be educated on the harms and health risks of hookah, since there were a lot of people, even young adults, that stood up at the public hearing that said that they didn't believe that hookah was something serious, something that needed to be addressed. It wasn't harmful, and a lot of these business owners played a large role in the revision of the ordinance, so we do think it's important to target them when we do education. And there also needs to be a quicker call to action, because these public hearings were brought on very last minute. We weren't able to gather enough support for the ordinance at the public hearing, so that did play a role in the voting. So for our next steps, we do want to push for smoke-free multi-unit residences, since individuals are still allowed to smoke in private residences as long as they aren't used for child care, adult daycare, or as a health care facility. We do want to connect with Georgia Department of Health and DeKalb County Board of Health to push for a county ordinance. Therefore, Clarkston would have to fall under the county ordinance. And then we have recently been collaborating on a campaign to push for smoke-free Atlanta. So hopefully Clarkston can feel some influence on that as well. And then we want to create one-pagers that will be disseminated in Clarkston and within schools in Clarkston. And then connecting with law enforcement to see how they plan on enforcing the ordinance, such as conducting tobacco compliance checks, since that hasn't been done yet. We've only been doing alcohol compliance checks, so That'd be pretty interesting to see how that goes. And then we want to provide success stories. A lot of businesses that were at the public hearing, they're like, well, the county hasn't pushed for anything. We haven't heard of anything being passed. So we want to provide success stories to Clarkston and tell them that smoke-free ordinance is good for the community, that it's not necessarily bad for a business, but that it could boost them up as being a non-smoking business. But yeah, so I think that is it, and if you guys have any questions, please let us know. Yeah.
Great. Thank you so much, both Caitlin and Liz. That was a wonderful presentation. So now we will be moving on to our Q&A. So I know many of you have questions in the chat box for mostly Asian smokers Quitlines. If you have any for Caitlin and Liz to answer, please do post those questions. And along with our three presenters, we also have a few panelists with us today. So we have Rod Liu, who's our Executive Director at Appeal. And we also have Wat Sintharatana, who's worked closely and directly was involved with the smoke-free Clarkston Indoor Air Ordinance. So both of them are experts in their fields and can really help answer those questions for you. So let's get started on some of the questions that we had flagged earlier. So Terry, some of these are directed towards you. So can you share with us examples of individualized care plans that have been developed for your clients?
Sure. So I assume that these questions is regarding the planning our councils helping the smokers to come up with. So for the individualized care plan, basically for clients when they call us, we have to find out what are their motivations to quit smoking. And then different clients could be having different reasons to motivate them to make a quit attempt. And then if their motivations, for example, it's because they have grandchildren or they know that smoking is bad, and but they just don't know how to quit, or they do not know where to start with, then we can use it as an entry point to help them to focus on these motivations. And then for the plannings, what we are doing is we want them to think about what is the time that they always go to smoking. And we found that there are top 3 triggers that smokers shared with us. The first thing is they feel so stressed out, or they feel that, there are so many things that they have to handle and they do not know how to handle them, and it creates stress to them. So that's the time that if they feel they are really, really stressful, and we will help them to think about, instead of, being stressed and go outside and smoke, perhaps there are some other things that can help you relax as well. We know that, stress could be due to the problem. You do not know how to resolve it. That's why you feel like stressed out. And we want to let them know, smoking cannot help you to resolve the problems. It just makes you feel that you're relaxing, but trying to use another way to help you to relax, perhaps go outside to have a walk or drink water, delay the urges and the cravings of the cigarettes. So this is one of the situations that we share with our clients, and then to see that if they could come up with something that they really like to do, not just us telling them what to do. Our role is more like a coaching to guide them to think of something that they haven't thought about before, and hopefully they can have personal ideas and the ways that they can help themselves to change their behaviors, change their habits, and later on they can become a smoke-free person. So this is some of the examples that I can think of.
Great, thank you. So this question is directed towards Watt or either Caitlin and Liz. How is smoke-free law or health policy in indoor or public places nationwide? Is it different from state by state?
So I'm not too familiar with the smoke-free nationwide. I know other states have done it, but it is different state by state, and it is different city by city. So like I said before, they only allow smoking within 30 feet. That could differ city by city.
Okay, thank you. I have a question from Helen Barrow. I think this is directed towards Asian Smokers Quitline. So can we order rack cards if we practice in Hawaii? Sure, I think that's directed towards you, if you know that answer.
Okay. All right. So, sorry, can I repeat the question?
Sure, it says, can we order rack cards if we practice in Hawaii?
Oh, yes. We do have rec cards in different languages, and we changed the rec cards, the look a little bit, and but it's having the information that people need to know, and it also comes in simplified Chinese, traditional Chinese, Korean, Vietnamese, and we also have it in English just to help the providers or the community partners to know what are the contents are like, and they are available on our website.
Great, thank you. Trace is also directed towards you. If smokers sign up online, can they set up a specific time for ASQ to reach them?
For that one, it's a very good question. We do not have that option yet, but we can explore that idea, and then I can make an announcement if we think that it is something the community, the field think it's going to be useful for our smokers, then I can inform everyone. But as of now, we do not have that options yet.
Great, thank you. Liz and Caitlin, this one's directed towards you. Do either of you have recommendations for creating strong support for policy change among business owners?
So Clarkson is actually a special case because Clarkson does have a lot of different cultures and ethnicities. So a lot of these business owners do have different opinions. A lot of the opposing side was from adult establishments. So they did play quite a big role in the revision of this ordinance. We're still trying to figure out how we can get business owners on board, but as of right now, they are not quite fond of the ordinance. So we're trying to get more education out there for them, because we want to target not just their customers and the business owners, but a lot of these business owners do have family members that work in these establishments, so they're also being directly affected by smoking, hookah smoking, whatever kind of smoking. So we do want to touch on that piece.
And just to piggyback on that, are you finding pushback from business owners of all kinds, or just business owners that are in the tobacco industry?
It's mostly from the tobacco industry.
Okay, great. Thank you. And then, Cherry, this one's directed towards you. So how different are smoking quit rates in the three groups after your intervention?
Hi, for that, I think I need to take a closer look for the research, and then can I provide that response after our webinar today?
Sure, okay. And then two more for you, Cherry. So some helplines, including gambling addiction, for example, domestic violence, use a language line to assist. For Asian languages other than Chinese, Vietnamese, and Korean, are there any such resources for tobacco cessation?
I am not 100% sure. I know that in some cities or counties in some of their states, they may have some local programs that offer languages other than Chinese, Korean, or Vietnamese, English, or Spanish. They may have some other dialects or the language that they speak. But for things that is like a systematic nationwide tobacco cessation quitline like this, I don't think so. So what I would suggest to do is probably explore from the local programs to see if there is anything similar to this. But as far as I know, I don't see anything that is like a national Quitline, like a 1-800-QUIT NOW or ASQ at the moment.
Great, thank you. And this last question is directed to both CPACS and ASQ. So how can organizations partner with both of your organizations?
Oh, okay, I'll go first. This is Cherry. So to partner with ASQ, it's very easy. First of all, just contact me and let me know you're interested in doing it, and we are always welcome to any kind of partnership ideas, or we can explore the possibilities of things that we can do. And there are some easy way to start the partnerships. First of all, you can go to our website, sign up as our referral providers, and to start referring the patients, clients, or community members to ASQ. Or if you do have some ideas about like promoting ASQ through your local newspaper, radios, or other types of media promotions, let us know as well. We can work together on that. And or if you have some kind of trainings, kind of like what we are doing today, and we can also discuss about that possibility too. Or if you have a particular request or certain things that you want to do together, please feel free to contact me.
Great, thank you. And CPACS?
Hi, so our strongest recommendation is to join our GATE Coalition. So you can contact any of us. I think our contact info was on a slide earlier. But I did want to go back to that question about getting support from business owners really quick. We actually go around to different businesses with council members to ask if business owners want to attend one of our server trainings. So we visit these stores, I think we try to do it biannually. So these server trainings, they do include tips on alcohol and tobacco use and how these businesses can go about with the smoking and
Great, thank you. So right now we will now have a brief wrap-up from Appeals Executive Director Rod Liu.
Thank you, Farah. And I just wanted to first off say thank you to Cherry, Caitlin, and Liz for a wonderful presentation. We always look to Asian Smokers Quitline and the work that CPACS has done in Clarkston as really models for how to move tobacco cessation forward in the diverse Asian American Pacific Islander community. I wanted to just comment that we recognize with ASQ's great work, particularly with the Chinese, Korean, and Vietnamese community, that doesn't necessarily cover all Asian Pacific Islander groups. In particular, it doesn't necessarily cover Native Hawaiian Pacific Islander communities. And so we realize that there does need to be other types of cessation opportunities to be able to work with that community. And the other thing about cessation is that cessation is more than, it's really important to have Quitline access, but we also recognize that cessation is also about changing the environment to create smoke-free environments, and that's why we have had CPACS talk a little bit about their policy change work. And so together, it represents the package that we would love to see in many other communities. And so in addition to contacting Asian Smokers Quitline with their great expertise and CPACS with their great success in Clarkston, we also want to be able to offer that you can contact us at Appeal or access our RAISE network through Appeal if you are located in another area that is interested in moving cessation forward. We have additional resources that we might be able to share that can help your community move forward. One thing that I want to advance just as a kind of a teaser for what's coming up with Appeal is that in the early fall, either September or October, Appeal is going to be hosting a Asian Pacific Islander Young Adult Leadership Summit, something that we have been doing quite a bit on in order to get and grow advocates and younger advocates to be able to move cessation forward. So we will send out more information about that, but again, thank you for joining this webinar, and thank you to CPACS and Asian Smokers Quitline for all the great work that you've been doing all these years. Back to you, Fun.
Thank you, Raj, and thank you all for joining us on this presentation. We greatly appreciate your attendance and hope you took away great learning points from both CPACS and Asian Smokers Quitline. And thank you again to ASQ and CPACS and all of our panelists for generously sharing your knowledge and contributing to making a healthier environment for us all. So that concludes our presentation today. We again thank you, and please do look out for our post-webinar evaluation and let us know how we did. So thank you very much, and hope to see you next time.